I'm joined by COVID task member, Lancet Commission, Dr. Suneela Garg. Ma'am, thank you for speaking with us. We are seeing that overall, the cases are once again increasing. In last 24 hours, 3,000 cases were reported. When we specifically talk about some states, the numbers are increasing. Like 8 states have seen a rise in the cases. Specifically, Delhi is showing 12% positivity rate. What does that really mean? Is this a worrisome situation?
Thank you so much for having me with you. First of all, I'd like to say that, COVID had never gone out of our lives. It was always there. But only thing is, it's over a period of time, we all got vaccinated, but we also suffered while the Omicron wave was there, right? So we have got, both kind of immunity, that is the vaccine immunity and hybrid immunity. But then you see over a period of time, the immunity also wanes. That is one thing which you have to keep in mind. But also, at the same time, we cannot become absolutely complacent because, as I said, COVID had not gone out of our lives. So, mask mandate, at least, when we removed it completely, so people thought that it has gone. So, you see, that's one of the reasons is that as long as virus is going to be there, it will keep multiplying, right? And it will be, also mutating. But this time, you see, it's a combination of two viruses which are entered in an individual and genetic material of two got exchanged. So this is what we call it as XBB.1.16. So, and these, we have got almost, 340 variants of Omicron. So that is why it is a kind of a situation where we look at from the perspective that these are Omicron variants which are in circulation, but they are causing infections which are milder in nature, but we cannot take it lightly. You see, when we talk of elderlies, when we talk of, people with comorbidities and all, in them the infection would be severe. And as you talked about Delhi, definitely, Delhi also caters to, people around the state as well, and around the UT part also. So we need to keep that in mind that basically, whenever there are cases which are coming and what we are testing, it's also important to look at that part, but we need to be vigilant. That is one thing which is very important, that across the country we need to do the testing, tracking, treating, and also mapping of the hotspots. That becomes very important.
Do you think that probably the mask mandate, it should be made mandatory again, the restrictions should come back now that the positivity rate in Delhi is over 12%? Overall, though 2.7%, like you mentioned, but do you think that the mandate, it should be made mandatory now?
See, I feel that particularly in crowded settings, let's say hospital settings, which is within our control. So we must make sure that people who are coming for outdoor consultations also, they should be wearing masks. So that is one thing which is important. Healthcare providers themselves should wear masks, but also, all the people across who are coming to these OPDs or they are admitted in indoors, they should be wearing. But then other crowded settings like metro, Delhi has got metro where, we have got, lot of crowd on the metro stations and all that. The moment they enter metro station, they should be wearing masks. And, in the closed crowded conditions at all the places, we talk of theaters and all that. So there should be masks, where we can monitor, and there the exchange of or transmission of infection is higher also. And also let me add you that this infection is highly transmissible. What we are seeing may not be very serious as of now because, you see, as I said, that we are doubly protected in terms of natural infection and all. But one message I like to give from your platform is that people need to be, kind of cautious. Number two, they need to follow COVID appropriate behavior, not only masks, but washing their hands frequently and all that. Elderly should particularly avoid going to distant, crowded places and all that. That is important. And also, I will like to say that precautionary doses have been very less. So people need to take precautionary doses, or what we call it as boosters. They need to take that. And I will also say that we need to be watching, in terms of what variants are in circulation in terms of genomic sequencing and all that. So that is another part. And also, finally, I like to say one word, that let people not be their doctors. Let them consult, and they should not make indiscriminate use of antibiotics. And whatever slip or prescription worked for their brother or sister. That will not, work for them. So, indiscriminate use of antibiotics has got to be avoided. So they need to consult the healthcare provider, because these are all viral infections. If we talk of, we have got, particularly flu infection at this time, and we have got SARS-CoV-2 also. And most of the places are testing for only, COVID-19, because it's an expensive test when we talk about strain 2. But then another thing is that flu vaccine is available. And wherever people can afford it, they must go and they should take the vaccine. That is important, because it is available. With the private sector it is available, so it's not a part of national program, but then gradually that would be the decision which would be taken by policymakers, because every year we get a lot of flu cases during this season, that is from January to March and after rains. And WHO decides what strain is there in circulation, and accordingly we give the vaccine.
So you also mentioned that the immunity that we had, the natural immunity and also the vaccine immunity, by time gets waned. Do you think that probably the children should also be below the age of 12, or the children should also be, getting vaccinated? And like the booster dose, of course, you mentioned that should precaution dose, that should be the increase people, because it's only 27% of the population that have taken. But overall, do you think the children should be covered as well? Because right now the vaccination in India is available only for 15 and above. Do you think that below that age group also?
See, vaccination is available for 12 and above, we have got now. But only thing what I would like to say is that children, who are the priority groups as of now? Whenever we get, large number of cases, so our priority is to protect those people who are most vulnerable, number one. Number two is that in children we have to always remember that, infection comes and goes. That is there. And that is where, we have to differentiate between SARS-CoV-2 and flu also. In flu, the infection lasts for much longer time, and particularly when we talk of H3N2, it will last for a period of about, let's say about 3 weeks or so. So that's a persisting cough, and it's a debilitating cough at times, But whereas, our SARS-CoV-2 infection subsides in about 6 to 7 days. That's how we tell also you join back your duties. So that's another point which we have to keep in mind. But we have to be watchful of the situation, and we need to make sure that we follow appropriate behaviors, because that will prevent us against both the infections. And third is overarching is our pollution. That will also protect, because we are also seeing a lot of asthmatic cases also. So that is another point of concern for us. So if we have masks, we have to make sure that people make use of it, and especially, as I mentioned, in the crowded places, our elderly people and, healthcare workers, metros and all that. So these are some of the measures which somebody can, follow, and these should be rather, I'll say, implemented, because we only follow them when the orders come from top.